Hi, my name is Mackenzie. Did you know that one of the top 10 cancers in the United States is actually kidney cancer? So, although it's rare, it is a very deadly disease. And renal cell carcinoma actually accounts for 90% of the kidney cancers in the United States. And this is the type that I'll be focusing on today. It affects men more commonly than women, and we see that there are three histological types of renal cell carcinoma. We have a papillary, a chromophobe, and a clear cell renal cell carcinoma. Unfortunately, the clear cell renal cell carcinoma, um, well, it accounts for 75% of all renal cancers, but unfortunately, what we see is that it is often the most dangerous because it's not typically diagnosed or detected until much later in the stages. So, going right into the meat and potatoes of the presentation, we want to talk about the physiology of the disorder, right? So, what is happening with someone in what's happening in their body when they have renal cell carcinoma? What we see is malignant growth, and this occurs in the kidney tubules. So, the renal tubular epithelial cells are compromised. And why is this a problem? Well, when you have a mass in your kidney, you're not able to filter and clean the blood properly. So, what is the cause of this mass? Well, the Division of Medical Oncology at the University of Colorado talks about the different genetic factors. So, different things can be going on in genetics, certain mutations that cause the malignant growth. Specifically, for renal cell carcinoma, we see that the most common is the loss of the short arm and chromosome 3p. There are others, of course. There's the gain of 5q, there's the deletion of 8p, lots of different types of alterations that can go on that would cause the disease. Additionally, and I don't want to go on too much about it, but the von Hippel-Lindau gene is something that's very interesting because when an alteration occurs here, we see that this is a tumor suppression gene, and it's altered within about 50 to 60% of patients with clear cell renal cell carcinoma. So we're learning a lot more about what is causing these types of cancer. Another thing we're learning is that cancer cells actually take advantage of certain metabolic pathways within the body in order to survive. When cancer cells are exposed to different levels of stress within the body of someone with kidney cancer, whether it be stress from the immune system responding to the cancer or various drugs, essentially the metabolic pathways can actually help the cancer cells escape. Now, fortunately, we're finding out more research about this, and oncologists are discovering new ways that we can possibly target these pathways in order to come up with an alternative treatment. Now, speaking on the development of the actual disease, the American Cancer Society talks about the different factors. We have mostly what we want to look at is the size of the primary mass and where is it located. Is it in the is it still confined to the kidney? Is it curable or treatable, or has it spread to nearby lymph nodes? Has it even gone throughout the body, in which case it's considered metastatic when it's traveled to different organs. We have the 4 stages. We have the first one being where the cancer cells or the mass is confined to the kidney and it's less than 7 centimeters. Stage 2 is still in the kidney, hasn't spread yet, but it is larger than 7 centimeters. In stage 3, this involves the major veins, including a spread to the renal vein or the vena cava, or it might have spread to the lymph nodes by this point. In stage 4, the main tumor may be growing on top of the adrenal gland, which sits on top of the kidney, or it could also have spread, or may not have spread to nearby lymph nodes. Or lastly, which is the worst case, it has spread to distant organs. So there are a lot of different symptoms that come with this disease, with this cancer. Hematuria is the blood in the urine, and we see that sometimes it could be pink, it could turn bright red, or even the color of Coca-Cola. We also see commonly loss of appetite, fatigue, tiredness, unexplained weight loss. pain in your side or in your back, and it just doesn't seem to go away, and this is caused by the tumor growth. We often see also fever, and this is usually from caused by an infection that comes with compromised immune systems and cancer. It could also be from drugs, or it can be the result of tumor growth or inflammation of the tissue. So there are a couple different things that we can do. Mainly for localized renal cell carcinoma, we can do radical nephrectomy or partial nephrectomy. Uh, the radical one is where there's an entire removal of the kidney, including the pararenal fat tissue, adrenal glands, lymph nodes, the whole 9 yards. And then partial is simply removing the malignant mass, but trying to preserve as much as possible the healthy tissue. We also have another option for treatment, which is ablation, and that is basically destroying the cancer cells through heat or cold. The Washington University School of Medicine actually has a lot of good information out there on alternative therapy, which includes the targeting of VEGF, VEGF being the vascular endothelial growth factor. So in summation, this disease is rare, but it is also very serious. So you want to make sure you get screened regularly, maintain a healthy lifestyle, avoid tobacco, try to exercise, eat healthy, watch your blood pressure, and most importantly, know your family history. Thank you.